Imagine you get a tiny cut, and instead of bleeding a little and quickly clotting up, it just keeps bleeding. Even a small injury could feel like a big problem. You're in a constant game of chance, unsure if a simple bruise or scrape could turn into something much more serious. Now imagine what life would be like if you knew that one part of your body's natural safety net wasn't working properly. Hemophilia is that reality for many people. What is hemophilia? Hemophilia isn't just one condition, it's a group of rare disorders where the blood doesn't clot as it should. Instead of a quickly forming clots to stop bleeding, people with hemophilia face a delay, which can lead to extended bleeding after an injury or even spontaneous bleeding without any obvious cause. At the core of hemophilia lies an issue with certain proteins in the blood known as clotting factors. But what exactly does that mean? Well, you can think of clotting factors as a kind of first aid team in your bloodstream. When you get hurt, these clotting factors spring into action, working together to patch up injuries and stop the bleeding. In people with hemophilia, one or more of these essential team members are missing or working improperly. There are different types of hemophilia, and they're generally classified based on which clotting factor is missing. The most common are hemophilia A and hemophilia B. Let's break it down further. What causes hemophilia A and hemophilia B? Hemophilia A and B are caused by genetic changes, specifically variations in the F8 and F9 genes. Hemophilia A, this is due to deficiency in clotting factor VA. If you're missing or have a low level of this factor, it disrupts the whole clotting process. Hemophilia B, this type results from a lack of factor IX. Although it's a different protein, the result is very similar, a problem with stopping bleeding. But how does someone get hemophilia? Since it's often inherited, it's a condition passed down through families. Both types of hemophilia are X-linked, meaning they're linked to the X chromosome. This is why men are more commonly affected. They have one X chromosome, so if it has the gene variation for hemophilia, there's no backup gene on a second X chromosome, like women have. However, women can be carriers and, although rare, can sometimes show symptoms. What are the symptoms of hemophilia A and B? The symptoms of hemophilia can be frightening. They often go beyond the surface, affecting deep tissues and even organs. People with hemophilia A or B may experience excessive bleeding after injuries or surgeries. This is often the first sign. Frequent nosebleeds that are hard to stop. Joint bleeding, causing pain and swelling. Imagine blood pooling in your joints after a minor bump. Walking, bending, even sitting could become excruciating. Easy bruising, what might be a tiny bump for someone else could leave a big, dark bruise for someone with hemophilia. Blood in the urine or stool due to internal bleeding. For people with severe cases, these symptoms are more intense and can be life-threatening. Even a simple accident could require a trip to the hospital. Is hemophilia A or B more severe? Here's where things get a bit complicated. Both types of hemophilia can vary widely in severity. For instance, people with mild hemophilia might only notice problems during surgery or after a significant injury, while those with severe forms may experience spontaneous bleeding even without an injury. Generally, hemophilia B is seen as slightly less severe, but research shows there's really no clear-cut difference in how hemophilia A and B impact individuals. What matters more is how much clotting factor you have. Mild, 6-40% of the normal clotting factor. Moderate, 1-5% of the normal clotting factor. Severe, less than 1% of the normal clotting factor. How is hemophilia treated? Currently, the most effective way to treat both hemophilia A and B is through replacement therapy. This involves infusing the missing clotting factor directly into the bloodstream to help the blood clot properly. So, if someone has hemophilia A, they'll get factor VA. For those with hemophilia B, they'll receive factor IX. With these treatments, people can live fuller, healthier lives. In addition to factor replacement, there are also non-factor treatments. These help boost the body's ability to form clots and reduce bleeding episodes. Some medications commonly prescribed include desmopressin, helps to release stored clotting factors in the blood. Aminocaproic acid, helps to slow down the breakdown of blood clots. More recently, gene therapy has emerged as a groundbreaking treatment option. For both hemophilia A and B, gene therapies like Roctavian and Hemgenix use modified viruses to deliver a working copy of the gene responsible for producing the missing clotting factor. This therapy aims to provide a long-term solution by enabling the liver to produce clotting factors independently. It's still a developing area of medicine, but it holds tremendous promise for the future. Living with hemophilia, what's the outlook? Living with hemophilia has always posed challenges, but thanks to advances in treatment, many people with hemophilia can live long, fulfilling lives. Access to treatment has a significant impact on life expectancy. For example, a 2021 study in the Netherlands found that men with hemophilia live, on average, about 6 years less than other men in the Dutch population. But these statistics are improving every year as medical advancements continue. To summarize, hemophilia A and B are genetic conditions that affect the blood's ability to clot. Both types involve different clotting factors, factor VIE for hemophilia A and factor IX for hemophilia B. Symptoms include prolonged bleeding, joint pain, and easy bruising. Treatment options include replacement therapy, non-factor therapies, and gene therapy. Living with hemophilia can be challenging, but with the right care and medical advancements, individuals can manage their symptoms and lead fulfilling lives. Understanding the condition, accessing effective treatment, and spreading awareness are the keys to improving quality of life for those affected by hemophilia. Thank you for watching, and if you or someone you know is impacted by hemophilia, remember, knowledge is power, and together we can break down the barriers that surround this condition.